Good morning, social media breakfast. How are you guys doing this morning? I can't believe it's already the second Friday in October. Unbelievable. I don't know. Annie's here with me, so she's got that look on her face too. Can you believe it's the second week of October already?
No, it's kind of moved really fast, honestly, this year. That's at the same
Yes,
time.
for you especially.
Yeah.
Yes, especially for you. So I'm really excited to have Annie here. So first of all, full disclosure, Annie is we work with Annie. She's one of our clients, but she works at Houston Methodist Hospital System, working on their social media, and it's a big job for her because there are a lot of channels, a lot of people that, especially during this pandemic, it has been crazy. I can personally attest that it has been a little bit crazy because people want to know. They want to know, like, how are they going to get their health care, and are they going to be able to see their family in the hospital? And I don't know, Annie. I think a lot of people are going to be really excited to be here with you and hear kind of what your experience has been for sure. So why don't you talk a little bit about the beginning of this? So you really were working on this content plan before the pandemic started, which I think is the best part of this. It wasn't like you just said, "Oh my gosh, what am I going to do when the pandemic?" I mean, we did
Yeah.
that too, but kind of give us that. So I'm going to say good morning. So I see some people saying good morning on the side. Good morning, Katie. Good morning, Geeka. If you're here, make sure you put something in the comments. I can see all your comments, and you can too, Annie. It's on the right hand side. There's a comment box, so you'll start seeing some comments flowing in. And we would love to have this be as interactive as possible today. So do that. But I have, of course, my questions here for Annie. So we have them all ready to go. But I do want you to start thinking about what your questions would be. And so starting with that. So Annie, talk a little bit about what it was like becoming like the head of social media for a hospital system. Like, where were you before?
So I wasn't in healthcare before. I was in hospitality mostly. And so I did social media for a lot of restaurants, hotels, things like that, either at agency side or brand side. And so going into healthcare was different. Like, there was a learning curve with that to really understand the systems that are involved in healthcare, and really just like the lay of the land, I guess. But in a lot of ways, the actual plan that I put together for social media in collaboration with a lot of other people, it's really not that different from hospitality in a lot of ways. You're really still just trying to essentially serve people, and make sure they're getting the information that they need, answering their questions, things like that. So in a lot of ways, hospitality first for social media, service first for social media. It was really an easy transition in that way. It was actually really helpful to kind of help build this entire plan, just having that kind of a background.
Yeah, I think it's good too because it really is about serving the customer in the end, and the customer in this case just happens to be the people that come in for their healthcare. And I think it's not something. I mean, I know a lot of healthcare do this, but I don't know if it's front and center necessarily all the time, right?
Right. I mean, I do think there are a lot of healthcare institutions that try to do this, and but really, sometimes it can get a little confusing because you're helping people with their health. It's different than trying to get them their meal, or making
Very.
sure they get a health day.
Yeah, no kidding, right?
But yeah, so I mean, essentially though, it is kind of the same need, and really thinking about it in that way helped to construct how we decided to even build content around that as well, because we wanted to make sure that we were being relevant and we were helping people on their journey, and their journey just happens to be being a healthier them. But otherwise, that was always something that really did help guide that entire aspect of it.
Now, hospitals are really great at putting out all kinds of content like brochures and email newsletters and these kinds of things, but social media is a little bit of a different animal for content in a hospital system. So, how did you get the management buy-in on that? Because there's a lot like HIPAA rules. Like, let's talk about the hurdles, I guess, to getting something out that's really meaningful on social media.
Yeah, I would say, first things first. One of the things, I guess, we just when I was first starting, one of the things I was trying to explain to people too when I first started was that on social media, we're not in competition in the same way that we are in a lot of other ways. So when we're talking about buying a billboard space, like when people see those billboard spaces, they're thinking of us, they're framing their opinion of us in terms of what their other opinion is of other healthcare institutions as well. But online, it's not really like that. Everyone is trying to take up space online, every single account, every person. And so we're not necessarily just competing against our direct competitors in the healthcare space. We're competing against everybody. Health influencers, anybody that wants your attention, we're competing against everybody. Mm-hmm. And so really starting to like build that understanding with everyone that I was working with as I was collaborating with everyone was kind of helpful to help them frame up that, we really are trying to get someone to stop swiping, and it's not necessarily they're going to follow us or they're going to follow the other hospital in Houston. That's just not how people act online. And so it's really like, why would they follow us to begin with? And we have to be, relevant to them in some way. And that's more than just telling them what we want to tell them. It's telling them what they're looking to hear from us. And so finding out really user first, what are they looking for? What's going to be helpful to them? What's going to help them make better decisions about their health, their family's health, and kind of building a strategy around that, really.
Right. And then, the resources that are involved too. So, I mean, I'm sure some people listening going, well, Houston Methodist has all these resources and I'm just like a small potato. But I love what you just said, because that's the same for everyone. We're all like on the topic that we're talking about for our companies. We're competing against everybody else in that's even talking about that. So I think that's really like that level playing field that social media brings. But as far as like resources, you didn't really have very many when we first started. I can attest to that directly. So, I mean, there are resources, but you didn't have them. So how did you get management to be willing to let you have them, and talk a little bit about like what you put together as far as the content plan so that people can understand?
Yeah, I mean, the first thing I really did when I started was I did a complete audit of our entire social media presence, and every material we had, everything we created. Mm-hmm. And so really getting buy-in started with that, because I was talking about what we've done and where I envision us to be. And so I did our audit. I said, here's how we've done so far, and we need to start benchmarking, and we need to start making, moves toward this is where I feel like we should be. And so, and when I was doing that, along the way, I was building relationships, across the organization in order to get, professional video team help, and to get, I have a really great, blog writer that I work with really closely, and to really get those resources and to get people to just help pitch in. And then also, the way that we were structured before is everybody really got a say in how our social media content looked. And so really trying to guide that conversation was and be really confident in how I was projecting my opinions about it, or how I wanted our strategy to look, our tone to feel, everything about it. It took time. It took a lot of time, but in the end, it's a really big payoff. We have amazing videos that are really beautiful, professionally made. We have awesome blog content that also is shared on our social media. And really, it's just, we have a ton of really great collaborative relationships, and we have people all over the organization honestly submitting super cool ideas that, we can fit into our strategy. Maybe not necessarily in the way that they originally suggested it, but always there's always still something relevant that we can pull out of it that may be relevant to our audience. But it was always like keeping our audience in mind and then building relationships around that.
And actually, Julie had a really good question about that. Hey, Julie, how are you? This is her question. I'm going to put it up here so you can see it. Did you poll or survey your community or another population, such as email subscribers, to build that persona target? So how did you get your persona target for your content?
So I did it in a couple ways. First of all, it started with my audit. So I looked at who actually was following us right now and who was actually engaging with our content. So that was the first way I really started building our persona. Is people are going to tell you what they like, and that gives you an idea of whether you're kind of hitting the mark. And then also we have a target audience for our entire marketing department in general. And so seeing how the two intersected and what commonalities they had helped me build the persona. So I wouldn't say I necessarily polled our community that follows us in the traditional sense, but like they essentially told me who their persona was when I really started looking at the back end of all of our analytics.
Yeah. No, it's good. And that's a great way to build it too. I love how you did that because I think I mean, that's a good place to start because sometimes people don't know really what they want necessarily. You're going to see how they behave with that content. So that being said, I know that this was well underway just from being behind the scenes. I know this was well underway last year. Things were kind of moving toward this, but it did take a lot of time to build all of that. Those relationships across the board, and you were dealing with pretty strong leaders in their own spaces like PR and marketing and
Yeah.
digital. And so kind of how did you do that? So you said you had to be careful and talk with them, but give us some tips on how, like, if you were talking to your friend and they were saying, hey, I need to get my executives bought in to like this kind of a social media effort, what we're about to talk about, what would you do?
Yeah.
What
I mean,
advice would you give?
yeah. So number one, I would say be patient. And two, I would say use data. So really, part of how people can buy into your suggestions a lot easier is really when you're showing them data for what you're saying and being confident in that suggestion, because you've looked at the data, you can tell what's being successful and not successful. So the data is really just like the most important part in having those big conversations with people. I was super lucky in that, our leadership team generally is just open and curious, but just very thorough when they make decisions. So going through that process of, finding the data, doing the audit, doing the work, and building that strategy out really thoroughly and having those conversations over and over again, just to kind of reiterate how we were talking about it, really kind of is what was helpful. And it took a long time to get to the point that we got to by the time the pandemic started. But all of that time was really worth it because everybody is completely bought in and everybody really, we're all moving in the same direction now. So, I mean, you have to be a little bit patient. Not everything's going to happen right away, but at the same time, showing numbers and really kind of backing up what you're saying is what's going to be very helpful in continuing to have those conversations.
Yeah, no, that's good. So talk a little bit about your content plan. So I want to talk about your content plan, and then Julie has a really good question about diversity, which we can talk about in a minute. But like, let's talk about your content plan and sort of how you started to put it together. What was your thing? Just talk a little bit about the structure of that.
Yeah. So the structure, the content plan came together a couple of different ways. I really did start with that audit, and then I also put together kind of like accounts in the health space and then accounts a little outside of the health space that I really liked, that I felt like had the right look and feel that I felt like we should be emulating. So not all of them were health accounts. Some of them were, some of them weren't. Not all of them were hospital accounts. There were a variety of accounts, and we took them.
Can you give me an example of one of those, just like what that you liked a lot, so we know?
Yeah, I mean, women's health was definitely one of the ones we had looked at. We regularly look at Nike as well. I think they're just generally like a good pulse of like how you should create content plans for a variety of audiences. And then we also looked at social influencers just to see what they were doing as well. And so we were looking at all these accounts and saying, okay, like what are they doing that we really like? And what are they doing that we don't necessarily like? And then kind of just starting to piece everything together there. And then I also am on a super collaborative team. Like I'm on the content team. We work really closely with the blog. And so we also use a variety of tools to like help us see just generally what people are talking about. What are things that people are asking about in the health space, and trying to hone in on how we can talk about that in our way, and use that either through content pieces on the blog or making a video, because we feel like it can really be impactful in that way.
Yeah. So actually, that brings me up to something that we didn't really talk about, but Blanca asked this, and I think it's a really great question because this has changed over the last year. So tell us how what team you came in on in the hospital, and then where you're at now, and sort of how that evolution happened.
Yeah, so I started in digital marketing when I came in, and it was a really great experience. And a lot of it had to do with some of the other job responsibilities I had that were outside of social. And then as we started to progress, and as I was saying, I started working so much more closely. We were launching our blog at the same time. I ended up moving departments over into our creative services department, and so now I report into our content manager. And so now, our blog and our social media are much more closely aligned than it was before. And so that whole process, because really they're similar in a lot of ways, and so it made sense for me to move over there. And now we move in unison, even better than what we did before. So that's kind of how that changed. And I think it's been a really great experience being on the content team, because we have a super collaborative relationship. We talk about content all the time, just like a running chat of cool things we've seen, things we want to do. And so it's been a really great creative outlet to be a part of that team. And
Yeah.
it reports into PR.
Yeah.
And so the PR team is awesome to work with. They really have a great pulse of like cool stuff. They know the cool info. And so being able to work closely with them and collaborate with them so that I can get, the inside track into cool info is great too.
And digital is a paid, kind of a paid media team, and you're an organic media team.
Exactly. Yeah. Our digital team mostly works in our paid efforts, and they have a really stacked team, and they do a really good job. But mine is organic, which is an incredibly different process, because it's a lot less targeted. It's targeted, but it's not as targeted. So it made more sense to move into kind of more of a purely organic team to be able to kind of continue in that path.
No, that totally makes sense. So thank you. That was that. I thought we should have answered that up front. Sorry. Thanks, Blanca, for the question. Um, and then Julie had one too that I thought was really good, around diversity. So how are you dealing with the diverse population of Houston? She was talking about languages and topics or whatever, customization.
Yeah, so we really post everything mostly on our channels, mostly in English, because we've tried posting in Spanish, but we just have found that most of our population, most of the people that follow us, do interact with us in English. We run targeted Spanish ads to work that are in Spanish. We have Spanish blogs for them. So for people that generally are Spanish speaking as our first language or prefer to speak in Spanish, we do have that we kind of push out for content. And as far as diversity, we have a very diverse organization, and so we really we utilize a lot of people across our organization to help us with our content pieces, our videos, our photos, everything. And so we do celebrate the diversity of our organization in that way.
Yeah, absolutely. And so, yeah. And you guys have also done some stuff during the pandemic too. So that's been interesting as well. Let's switch to the pandemic because it's such a big piece of what we're going to talk about today. So talk about like when you first started to realize that things were going to be a little bit different around the office. Just give us like your story. What happened?
So we had started noticing the virus in China in February, and we did some content pieces starting in February about it. But that was when it was still localized to Wuhan, and we weren't really sure. We didn't realize it was going to come everywhere. But we had started making content around that, and we were doing a series called "When Should I Worry About?" And it's really just we found the most Googled questions about it, and we had one of our lead pathologists answer them, not just go through and answer those questions. And then as things started changing, we did an update to that video because, within a couple weeks, a lot of those answers changed. And so we did another update with another one of our lead doctors where she then answered the newest questions. And then within a week after that, we were all home. And so we had a lot of challenges, as everybody did, at that point, where luckily, like my job is very easily transportable in a lot of ways, just because it's all online. But we had some things that we weren't used. we weren't used to being able to not go into the hospital. We weren't used to like having to try and figure, not have meetings in person and anything like that. And so we had to figure out, and in addition, people were really scared. I mean, like offline, everybody was so scared, and and we were supposed to be the source of information. We were supposed to give everyone what they needed to know to be healthy and to stay safe. And so we had a really big responsibility on our shoulders to, even though with all these challenges, to really make it happen. Like we had to be that source of calm and safety and health for the community. And so we had to find a way to do that. And we had to do it remotely without the huge amount of resources that we had before at our disposal. And so we kind of came up with a few ways of doing it. One, our blog, our lead writer, she wrote a ton of really amazing articles on very specific topics that people needed. So we were able to post constantly. We posted, we had updates on patient and visitor information. We created a web page, pinned it to the top of our pages. So in case anybody was just going to our page to find out what they needed to know, they could find it as easily as they could. And then finally, the last thing that we had done just at the very start was we started a new series called Ask Me Anything. And we were like, we needed a couple things. One, we needed to calm down the community. And two, we needed content ideas. We needed to know what people were scared about. And we needed to answer them. And so I had a group of doctors that were like totally on board to do it. And we just had a video of them. It was like from their office, like a video call. And then I had, I posted it and I said, just ask us whatever you want to ask us. And the doctors sent me their answers. Every time I was getting a question, I was sending them to the doctor and they were giving me an answer and we were answering every single thing. We got a lot of great content ideas out of that. And I think honestly, a lot of people in the community just felt better. They had these really specific questions and it was hard for us to know what was in their head to help ease their fears. And so just asking them to tell us so that we could give those answers was honestly really helpful. And we did, I think, 4 or 5 of those different series, spread them out every single week, every 2 weeks, until we were getting to the point where I think people felt more comfortable and we weren't getting as many questions. So we felt like we had done our job there.
Yeah, no, it was good. And it was very, very popular. Lots of people took you up on that, which I thought was great. And then it did spawn the content that came after, both the blog posts and the videos. And so I think Blanca just brought up the video of, and yes, she did. Sorry, that's Gika. Sorry, I did that wrong. Yes, this video, the specialty unit was caring for the senior patient. So let's talk a little bit about the videos and the behind the scenes, because it's not just been this video, it's been multiple videos that are showing behind the scenes. And talk to us about your thinking on that, why you sent a film crew in to the hospital. I mean, it's hard to do that and get those kind of HIPAA I mean, there's so many requirements that you guys don't even know about that you have to get over to do these kinds of videos. So could you talk about that a little bit?
Yeah. So another part of the plan is, and again, a lot of it stemmed with like the community is scared, and what can we do to, one, make them less scared, 2, bring them together. And so we were like, what is a good way to kind of show them what we're doing to make them safe? And so it came up organically in one of our leadership calls. We all were brainstorming ideas, and this Day in the Life series kind of showed up. And so I sent an email out to the whole community, and I asked our hospital community, and I said, hey, do you guys have any great stories that you feel like we could follow that are COVID related? And someone in our community did say, yeah, I have one. I have this guy, he's setting up our highly infectious disease unit. This unit was originally set up when the Ebola outbreak was happening. And so we were turning it into a COVID unit. And so we should look at following him. And he was great. And, we talked to the video team and we're like, are you okay with this? Because also it's risky. I don't necessarily know the health of every single person on our team. And so are you okay with it? Is this something that you're willing to do if we take the proper precautions? And our video team has been amazing. They've really gone in and done the work. And so they, you know, they wanted to go in and tell this story, and so they did. And our head of the video team, he went in with all the proper paperwork and everything like that, and this story just kind of unfolded that day while they were there for the entire day. And so they kind of followed the nurses that were in charge of that. And but yeah, so the behind the scenes look was really a way to kind of give people an understanding. I mean, if you're not in the healthcare field, you really wouldn't even know that this was going on. But to know that there is a whole place where we're taking care of people, and honestly, our nurses care so much. Like, when you can't be there to be with your family, knowing that they care that much is such a reassuring thought. And the family that was involved in that video was so great to let us really tell their story and treat it as a great memory for them, like a good way to remember, their grandpa, their dad. So
Mhm.
yeah.
Yeah, grandpa was amazing. And I think the other thing that was interesting, because you've done some more behind the scenes since then, quite a few actually. What's great about them is that people can see what it's like in the hospital right now, because there were some fears. So there were some fears around people coming to the hospital to get treated. So can you talk a little bit about that and sort of how this kind of content was helping get people over the hump to get to the hospital?
Yeah, I think what scares people a lot too is they just think that the hospital's overrun with people with COVID and they're just everywhere. And really, there's a lot of precautions in place. It's probably safer than ever to go to a healthcare institution, to be honest.
Mhm.
And so we needed a way. It's easy to talk about it and say these things, but like, I'm a very visual person, and I know that a lot of people really are. And unless you honestly see with your own eyes that, like, yeah, everybody's wearing masks. Like, you're getting your temperature checked, you're getting screened. They ask you a bunch of questions when you walk in the door. And and even if you go to the emergency room, nobody's just like sitting around and coughing anymore. Like, everybody's in their own like area. Everybody's spread out. There's a lot less furniture in there, things like that. And so we were like, we need to start showing people, because what also happened is people were just like too scared to come in, and they were putting off appointments that they really needed to go and do. Like, you really should go and get your checkups, and you really need to take care of yourself. It's probably the most important time to ever really do that, honestly.
Mhm.
And so it was important for us to show people, like, it really is safe. Like, honestly, please go in, do your appointments. Also, if you break your hand, like, don't avoid going to the emergency room. Like, you need to go, and it's perfectly safe for you to be there. Safe, probably the safest it's ever been. So we kind of created this behind the scenes video series, essentially, to start showing that, to show people, like, you can see we've gone in and done a bunch of B-roll, and you can see the whole process. Like, if you were to go in and go to the emergency room, this is what it actually looks like in there now. And we've done that with a couple other situations as well. We've done that with mammograms as well, so people can really see, like, it's really not so bad to go in. It's not going to be as crazy as you think.
No, no, it's definitely not. And Larissa is actually she's watching on YouTube. You can also watch on YouTube. See, we watch on, and I'm sure some people are in LinkedIn watching too. Hi, the LinkedIn crowd. But she works at the Alley Theater, and they've been doing some of the similar things like behind the scenes too. So I think that does help, because when you can't go somewhere, I think it helps to have the ability to see what's happening. So giving an inside look in it, you have a really great film crew that's like really professional, but honestly, it could have just been simple things, for some people. You don't have to have like a big camera rig. You just have to have the like some kind of way of showing what's happening there. So I just want to be clear. I know that you do, but you didn't used to have the film team working with you either. So it took a while for you to get that video team on board too, right? As part of that.
Yeah, it was a learning process between us and the video team, because they weren't used to being a part of the organic process. And so seeing, how much time they were willing to give me and work with me, that was a process. And, now we've gotten to a point where I think everybody sees the value in what we're doing. And so, they're willing to give us the time, and really, they're also like a big part of the brainstorming process. Like, they also have great ideas that they come to us with, that they think that they also want to film or do. And so, yeah, it's been great. But I mean, if you don't have all of that, that's okay. You kind of learn on the job. I've definitely not always been in jobs where that's happened, and you kind of learn how to make it work with your phone or whatever else you have available, honestly.
Yeah, no, it's true. And so, question for you, kind of changing the subject a little bit, not a lot, but a little, and that is, what has been the reaction to all this content, like you talk about numbers, from a numbers perspective, and also, how has this changed the way that you function? This whole COVID, this response effort, how has this changed the way people are responding to you inside of the organization? Because there's been some changes.
Yeah. I will say, like, you're going to see a lot in any healthcare institution, like, or almost probably a lot of places anyway with COVID, just because people were online more. But then
Mhm.
also, in addition to that, like, we've seen like a huge increase in our numbers in a positive way, reacting to our content. So that tells me that tells me that we're being relevant and we're giving people the content that they're looking for, which has been great. So that's been kind of nice to finally kind of see. It's been 2+ years to kind of see it all come together like that, and to see it really just kind of taking off has been great. And as far as the organization, I think everybody's noticed as well, and especially with the way that COVID changed things. Social media became a bigger mouthpiece than it really had before. Like, it organic social media wasn't always thought of first if we wanted to talk about something. But now, and especially with the challenges that we faced with COVID, and then after seeing the success of how we were able to talk about topics and how we were able to get information out to our audience, it's really changed the way people view how we can interact with organic social media with the same priorities we've always had as an organization, but just letting us talk about it in the way that we know our audience likes to hear it, and giving us that opportunity. And so now, I'm pulled into a lot more conversations about priorities or things that we want to do, as an organization, and how social media can be a part of that than I really was before. So it's really been a way people have started to notice that social media can be really great and impactful for the organization. And we probably wouldn't have gotten that opportunity unless we'd been in like a serious health crisis, or it would have taken a lot longer to get there. But COVID really became like a pressure cooker that, and luckily we rose to the occasion and really kind of showed the great things that social media can do.
Yeah, and I guess I want to bring up the customer service aspect again, so tie into what you said at the beginning. Um, can you talk a little bit about your philosophy on customer service for those channels, and like sort of how you do that? Like, how do you make sure that you're giving the kind of customer service that's necessary?
Yeah, we have like a great community management document. So we try and answer as many questions as we can. That's really honestly like the most important part is when I say we want to be helpful, I mean we want to be helpful. Like, we want to answer questions. We want to give people the answers that they need. If they're upset about something, we want to take care of it. If they're happy about something, we want to be there to cheer them on as well. There are always restrictions with that because of HIPAA. So there's, we can't do all the crazy things you could do when we were in hospitality, but at the same time, we really have a great community management strategy, and great people executing our community management strategy. And
Okay, Katie and Tracy, they're listening to you, so they'll be
yeah,
happy to hear you.
but honestly, like, super open communication with them has been amazing, and super on it. We have a great pulse of how quickly we want to respond to things, how often we want to respond to things, and being really open with each other, and really raising a red flag anytime something needs to get escalated or dealt with. And anytime we also in the organization needed to like give some reassurance to our healthcare staff that like people are on their side. It was really tough for a while, and they were getting really beaten down. And so posting about them and answering those questions, and then showing our organization like, hey, and showing the nurses and the doctors and the staff that like the community is really here for them as well. I think having those conversations with people was great.
Yeah. And can you talk a little bit about the limitations? Because I think for how you have to deal with people, because I think that's something people don't understand necessarily either about the healthcare side. So I know this is very healthcare specific, but like, can you talk a little bit about that?
Yeah, so one of the tricky things with healthcare is that you have to protect people's private health information, like kind of at all costs. Like that's really important. And so there's a little bit of a dance you have to do with the way that you respond to people. We try to make it as personal as possible. We really don't want to sound like a robot because there are real people that are back here answering all of these questions, comments, everything. They're not robots, they're real people.
All them up.
Yeah, and so we want it to be as personal as possible, but we are restricted in exactly what we can say. We cannot in any way acknowledge or confirm that you may or may not be a patient. And a lot of that comes down to consistency. So responding to every single person is part of that, because then no matter what, you can't tell whether a person's a patient or not because we respond to everybody. So if someone's complaining, whether they're a patient or not, I don't know, and we don't have access to that, and we don't need to know that. But we respond to everybody as if they have a real complaint. But we have to be super careful. We have a set of like legal approved responses that we know that we can do successfully and without violating anybody's private health information. Because honestly, like Facebook is not a HIPAA compliant platform. And so you have to really be aware of that and be careful with people's health information, not encourage them to overshare because it's not really safe on this platform. We want them to share when we know it's going to be safe and private and they can really kind of talk us through whatever's going on. And so we have an entire very extensive document that kind of outlines all of these rules and all of these if this and that scenarios. And it's a complicated little web, but we have it so that we really can make sure that we're doing the right thing for the community. When they have a conversation with us, they should be able to trust that, you know, we're going to keep it safe for them. And so we really try to make sure we do that.
Right. And if they come on and I just want to say this too, if you come on and say, my husband was at Methodist Hospital and he had this procedure, then what happens? Yeah.
Yeah. So it's very limited at that point because we can't have a conversation about your husband's health. We can kind of have a conversation about your health if you're revealing it, but like we really can't have a conversation about your husband's health. And so if there's a problem or if there's something positive, we have these legal approved responses because we know that this is not a conversation we can have online with somebody. And so sometimes it may feel like we're leaving people hanging in a way because, you know, they came on to talk about something that happened to their husband or something that happened to their mom or their parent.
Or it even could be nice. It could even be a good thing.
They could be saying really nice stuff. But it's just, we really can't accidentally do something that confirms or denies or reveals any sort of private health information or has a health conversation with someone outside of that person who really should be the one to decide whether they can reveal that information. And so we have to be very careful with that. And so our responses can be very limited, but we have a whole set of rules that we have to follow to make sure that we're doing the right thing.
Right. And she wants to know what more do we need, Christina? Christina says, what other restrictions you have besides HIPAA related stuff? I
mean, there's also like just general like healthcare restrictions that just exist across the organization that are not social media specific. You know, we can't like run a contest. So we can't pay people to like be an influencer for us. Mm-hmm. We can't do any of that stuff because you can't technically incentivize people for healthcare. And so, I mean, those are just kind of the regulations within the healthcare space. It's something that we're okay to work around. I don't have a problem, you know, with any of those. We don't need to do a giveaway. Anyone that's like done any first person articles or accounts of their experiences, it's because they really just wanted to share, you know, their experience, whatever that is. And we welcome that. Anybody who loves to share has gone through something really unique and impactful. Like we do welcome that, you know, with the proper permissions. But yeah, so those are the other like major regulations. But I think that those are more minor in a lot of ways. The HIPAA is really like the biggest one because that really limits communication.
Right. And then I think there's some other things that we run up against too. So I'd like to talk about misinformation because that's such a huge thing right now in social media. And we have run up against a lot of misinformation. So how do you recommend people deal with that on their pages?
Yeah, I would say try to be as transparent as possible. I wouldn't go and attack the misinformation. I don't think it's worth. I don't think it's worth the time and energy. But really, kind of thinking through, well, what is the misinformation coming from, and how can I address that in a way that's relevant to my organization and relevant to my audience. Not everybody is going to believe the misinformation either, and so I know at the beginning of COVID, that was part of what we were up against, is that there was a lot of information floating around about COVID that may not have been right. And we needed to kind of address a lot of those things. And so that was part of the Ask Me Anything series, is finding out what that is so we could correct it. And creating content too. We've created content around this information as well. We did a great video last year on mammograms versus ultrasounds. That kind of talks about, there was a question out there like, well, why can't I just get an ultrasound? It's a lot more comfortable than a mammogram. And, we went in and we addressed it. And so that's kind of how I would deal with it if that's the kind of misinformation you're looking for. As far as like bad reviews, you just got to fill it up with good reviews too. That's really how it is. You don't want to get into a fight with anybody online. It's not a good look. So you kind of just have to go through and do your best to do the right thing with your content, with the way that you respond to people. And ultimately, that's going to show through. That's going to show through for the organization, for you as well. And people are savvier consumers than you kind of think they are. They're going to be able to look at the situation and make a judgment call as well, and like understand what's right and what's maybe not, what's maybe a misinformation as well.
Yeah, no, that's good. And I think that's something that I think everybody's dealing with right now on all their channels. So one of the things, let's talk about deleting versus hiding comments because I think that's a good tip for people. So let's talk a little bit about that. So do you delete comments? Do you hide them? How do you manage like these things?
Yeah, we don't delete comments. I think when you delete a comment, it really makes people feel like you have something to hide. But we do hide comments because, well, one, we don't necessarily want to encourage a lot of negative conversation. If someone has a problem, we answer that problem and then we hide it because also we don't want necessarily to like reveal someone else's health information as well. But I would definitely recommend hiding over deleting. Hiding basically means that that person can still see their comment, they can still see your response to the comment, and their friends can still see that comment and still see the response to the comment. So they don't feel like you're hiding anything, because if you start deleting the negative comments, it's really going to make it look like you have something to hide, and you don't. And so I would definitely recommend that over deleting for any.
And Facebook allows you to do that. Not all social media channels will allow that. So.
With channels, we don't delete either. We just kind of leave it there.
And also, there's a lot of moving people to the customer service process. So that's something that, there's a phone number that's specifically made for customer service.
Yeah.
And you can't solve their problem on social media, right? So talk about that just a tad.
Yeah. So basically, because we are restricted with HIPAA. We don't really solve anybody's problem on social media. We can't, because we can't have those conversations because it's not secure. So as much as we can, as early as we can, we give a phone number and then they talk to someone who's a guest service professional. They are very equipped and adept at handling those issues and trying to resolve situations as much as possible. They have access to the information that we don't have access to. So any sort of health history, anything like that. And so they can really help you in a much better way than we can, because we're not connected to that anyway. So as much as we can, we try and push those conversations offline to the healthcare professional, to the guest service professional that can really help them solve their problem, because we can't necessarily solve it.
Mm-hmm. Yeah, I think that's important to know too, because even if, the hospital system for sure, because of the HIPAA stuff, but really almost anything is like that, because you have to be able to look and see if somebody was actually a patient, they were actually who they were dealing with. I mean, there's a lot of pieces to that. So like customer service things online they can really like balloon out of proportion too. So if you can't handle the situation, so I think that that's good what you do. Okay, good. So do you guys have questions? I mean, I'd love to hear your questions. A few of you threw them in as we went along. I'll give you a little kudos here from Blanca. She has been a part of their spiritual care team.
Oh,
Oh, actually,
nice.
there was a good video about that. Could you talk about the spiritual care? Like there was a really good video, right, of the chaplain, right?
Oh yeah, we had a chaplain who did like a nice reflection. Oh no, I know what you're talking about.
Yeah.
We did follow we did follow one of our chaplains at Houston Methodist Sugarland, just because we have a great chaplaincy program at our hospital, and it's changed so much because of COVID. They can't go into rooms, and so they're doing like really cool stuff to really connect with patients and with families. And they've been like a huge contact for families to really help them soothe their like worries and stuff with COVID and everything going on with their family in the hospital. And so we did an awesome it's our medical ICU unit at Houston Methodist Sugarland, and we followed our chaplain, and we also followed one of our medical ICU nurses who's in charge of that department. And it was
I
really
think one of the things that video was really good at showing is one of the things that Methodist is doing, and I don't know who else is doing this, but I know that Methodist is really Houston Methodist is doing these iPad kind of things where they roll the iPad into the room. Could you talk about that a little bit? That's really cool.
Yeah. So a lot of like if you can't have visitors to the hospital, you can have video calls, and so they've attached iPads essentially to like I don't even know.
Like
It's
a
like
pole. It's one of those poles like the bagging poles or something.
yeah. So they attach it to a pole and they put it in the room, and they set up the video call for the patient. A lot of times it's the chaplain, and then they invite the family on the other side. In this particular video, we had the chaplain on with the family, kind of facilitating and leading them in, a prayer and a reflection.
Zoom. It was kind of like a Zoom. He was in his office. The iPad was in the room, and the iPad had some sort of case around it for like, I guess, to keep the virus off
Like
of it.
health reasons, so they could like wipe it down afterward.
It's super cool. And like, yeah, it was like this really good case. And then they roll it in there. And then the chaplain's in his office, the family's at their house. So it's like kind of like I don't know if they use Zoom. I don't know what they're using, but a Zoom call kind of thing where everybody's on the line like we're here. It was cool. I mean, to see that and like to know like, oh, and I told my family, I would have said that anyway, but I'm like, I want to go to Houston Methodist if I get sick because I know then you guys could actually talk to me.
Yeah. Yeah, I think it's been cool having that as an option for people, and people are more comfortable with video calls than they've ever been. So like, yeah, I think it's cool.
Yeah, she followed up. Yeah. Yes, absolutely. Oh, she did her chaplaincy in Sugarland. That's awesome. Okay, so here's a good question. How big is your social media team?
Well, brand side is just me. And then I have an agency that I work with in order to help with a lot of the community management stuff. And then I collaborate with a lot of departments. So to kind of basically to help. So technically it's just me, but like I also work with, a 5-person video team and 2-person blog team. And so I'm not really on my own. There's a lot of people that help essentially.
Yeah, but it's also because you've built those relationships over time, like the SME relationships, the different department relationships, and from the agency side, which I am the agency in case you guys weren't realizing it, we revealed that at the beginning. But there's 2 of them really that work it pretty much on the regular, and then I do a little strategy work occasionally. So there's 3 of us, I guess, but not all the time, and they're really only working part-time. So each of them, so there may be the equivalency of 20 hours a week. That's what you get. So a little bit more, 20 to 30 hours a week. So it's not quite even a full-time job. So there's like, let's say two people working on the, let's say Houston Methodist account, then all of the people that you work with around the hospital, and you're grabbing resources from different departments. So that's been I think that's the story here, is that no matter how small you are, you can be mighty if you can collaborate. So yeah. So a little bit about measurement. Can you do that real quick? Because I said we would talk about how you measure and like, how do you know something's successful on social media for you?
Yeah. So one thing I would encourage everybody to do is like immediately start benchmarking. Like immediately. Just get a baseline of how you're doing right now. And then every time you post something, look at how that did in comparison to everything else. And then you can start moving the benchmark, which is what we've been doing. So we look at engagement numbers. That's like our probably our best guess of how things are doing. And engagement can be your reactions, comments, shares. Um, Reach is nice. Reach is great. Like knowing how many people saw it, but engagement is like probably my number one for deciding how that content did. And so we look at that all the time, and really make sure that we understand how we're doing, how we did that compared to last time, the last video we did, what's different, what's better, what's worse. So we're constantly evaluating ourselves based on these numbers. So benchmark and then kind of go from there. And it may take you a while to get a good pulse of like what should be normal and what should be better than normal. But I think the more you do it, the more you go at it, the better you're going to get at it.
Yeah, and one of the numbers we've looked at over time, and I don't know how closely you're looking at this now because you kind of take care of this now, but one of the numbers we have looked at over time is who's following us from where. So like we look for the mass number of people to be in the Houston area because this is our home base. So like if a bunch of people are following us from Bangladesh, that's not like necessarily as good as if a lot of people are following us from around the Houston DMA.
Yeah, that's really good to point out because I kind of forget that we do that. But like we definitely look at the quality of our audience. Because yeah, it doesn't really help us, especially knowing that we're very, we're Houston. We are a Houston hospital. And there are things that we do that's more national or international, things that people may travel for. But for the most part, we're here for the Houston community. And so looking at the quality of that audience, looking at the audience mix, and watching that change is important. So seeing that we've gone up in terms of even more of a majority of our audience is Houston based tells me too that the content we're doing is healthy and right, and we're following the right accounts and interacting with the right accounts.
No, it's really good. And I this must be your friend, but Lauren is saying, you made some great sourdough bread. So it is social media breakfast. So like share, share, share. Please share.
I had some this morning.
That sounds really good. And the thing about sourdough bread is you can share. It's a sharing kind of a thing.
We do share. If anybody wants a starter, let me know. We're happy to
yeah. We are like all about the healthy bread. That sourdough bread is great for you. And then of course, somebody loves your skincare routine. So we will be launching a new makeup line after social media breakfast. We'll be there. So awesome. So let me see what time it is. Boy, we're almost out of time. So I am so glad that you joined us today. If anybody has any other questions, please let us know in the comments. I'll make sure Annie gets them. We'll answer them if it's beyond the 9:30 point of time. If you watch this in replay. Okay, so there you go. That's a good one, Katie. That's a good one. Different Katie. Katie McCollum. What's your favorite project you've worked on that you haven't mentioned yet?
That's actually a really good question. I'm trying to figure that out. Easily, I mean, I've mentioned it a few times, but I'm going to say it again. My favorite project that I worked on was the Ask Me Anything series. I loved it. Like it was really fun. And so that was a super cool thing that we did, and I was really excited to do it.
And believe me, we got a lot of comments because my team were like, that was a lot of people that it really worked well. And I think having those doctors, like on board, like to have that set up is amazing. And you've also had some really great feedback from the head of talk a little bit about like the kudos you've gotten from above.
Yeah. I mean, I think people are seeing what we're doing a lot more now. And so, people are thinking about social media more. So now we're actually getting suggestions from people outside of my specific team that are much higher up in the organization because they are excited. So they have suggestions or video ideas or content ideas, which is super cool. Because that's not something that was happening pre-pandemic. So that's pretty exciting.
It wasn't. I mean, it was hard to get their attention. So it's amazing. Or not even hard, but it was you wouldn't have even thought you could. Like,
Yeah.
let's just say that. And also the resources that they're more likely to give you now that they see what the benefit is, right? So there's some benefits that have happened.
Absolutely, yeah. So I think, we've managed to steal a little more time from the video team than we did before. But so
It's been
yeah,
great.
I think I think seeing success makes people excited, and knowing that they were a part of it as well makes them super
Mhm.
excited. And so, really kind of bringing everyone into that success has been great, and like getting people's buy-in and getting them to help us continue to make it really successful is really what has been super rewarding and exciting for me. Yeah.
Yeah. So, thank you so much for taking time out of, I know, your busy schedule to come be with us today. Couple of things that I want to just say for I have a couple of announcements at the end here. So, we are actually gearing up for the end of the year. Cannot believe December is almost upon us. So next month we're going to have Todd Giantasio, who you guys don't know, he's from out of the area. What's nice about doing these virtual, what's bad is we can't hang out together. And I really miss everybody. I'm missing your faces. Some of you, though, can join that can't normally. And I also can have guests that aren't from the area. So I can have people like coming in and talking to us. So Todd's going to be coming to talk to you. He's an amazing marketer. We're going to be talking about, I'm not sure which side of it. He's very good at two things: video, online video, and also he's very good at like like Facebook ads. So I don't know. Why don't you guys tell me which one you want Todd to talk about? You are here, so you can help me. So he can talk either about a simple Facebook ad strategy, or he can talk about, he has a really awesome online tool called Zeotag, and he knows about video. So tell us what you want. And number two, we are doing the gift of guidance, which we do every December, and that's coming up. The deadline for nonprofits to apply for that is coming up. So we help 10 nonprofits with their online strategy. We're going to do this via Zoom this year. It's going to be really fun. And Rebecca Council is donating her Zoom thing. So she's got this really complicated setup, and you guys are all going to go into different rooms, and we're going to be able to talk with each other. So it's going to be really cool because it's going to be, we get to see each other and talk to each other and help 10 nonprofits. So two things are coming up next Friday, I think it is. And Katie, if you could go grab really quick the link for the event. It's on the Facebook page right now. There's an event. It says, nonprofit sign up. That is coming up quickly. The deadline is coming. And I think we have 6 right now that have applied. So there's room. So if you know a nonprofit that would be awesome that you think should get some help this year, please put it in. Also in that, there's a link to the volunteer sheet. So if you want to volunteer for this, you want to be a part of it, definitely click on that and fill out the volunteer sheet. We'll send out a couple more emails as well. If you're not on our email list, let me know and I'll make sure you can get on there. It's in our about section up on the page. So if you click on about, there's a link to the email to sign up for it. Anyway, that's pretty much what I wanted to say, but we're going to do it and we're going to like blow the doors off of it. Okay, guys. So let's do it together. If you're interested in being, a part of that, let me know. So, it's going to be, I can't believe it. That's all of the rest of the year. Todd, and then gift of guidance, and then 2021. How do you feel about 2021, Annie?
I'm ready for it.
Are we all? It's like,
yeah.
and tell us, are you going to get us a vaccine? I'm sorry. This is like, you're like my Dr. Fauci here.
Well, not me. You don't want a vaccine that I've created.
Absolutely. So guys, thank you so much for coming to join us today. Make sure you take a second and share this because this is great information. Just hit the share button and send it out to your friends. Help us spread the word about Social Media Breakfast online. Hopefully next year we'll get back to being in person, but always we are online. So share it out. And thanks, Annie. I will be talking to you soon. And I'll take care, everyone. Bye.
Bye. Thanks.